Hey guys, this is David Lee from Fitness Basecamp, and for most of you that have been following me, you know that I've just gone through my second knee surgery for a meniscus tear. Now, what is a meniscus and how do you tear it, right? So the meniscus is the padding between your tibia and your femur that your knee sort of sits in, and we'll pop up an image kind of show you an idea of what that is. So it's sort of you have the padding of the meniscus, and then your femur is working when you bend your knees. It's just rubbing on there. So it's the padding to prevent, you know, your whole bone on bone type of rubbing. So what happens is that this is the most common knee injury that people will get from a variety of reasons. And in my case, I was kiting, and it was just caused by I did a big jump, and then it compressed my knee quite a lot. So I tore it that way. Now, there's a lot of people out there that live with meniscus tears, but it just depends on the severity of the tear. And you'll find that a lot of people get a tear, but you know, just like quick changes in direction, twisting, you know, like where it twists in this direction. So that's how you're going to end up tearing your meniscus. Now, the next thing is, how do you know if you've torn your meniscus, and how do you go about figuring that out? Best thing to do is go to your general practitioner, and then you tell him what's going on with your knee, and then he'll schedule you an MRI, right? You know, he'll poke and prod and bend your knee and does this hurt and all that kind of stuff. And then he'll schedule an MRI. You go in this giant donut that makes a lot of noise, and then they scan your knee, and then you go back to the doctor and you show him the results, and they'll give you a report that says, yeah, you know, you have a tear, or however they structure all of that kind of language. But they'll tell you, this is what's going on with your knee. And when you go back to your general practitioner, what he does is he will recommend a surgeon for you. You can go with that surgeon, or you can pick somebody that, you know, you're more comfortable with. Then you go in for your surgical consult, right? Now, before we get into all of that, I want to make sure that you understand, whenever you injure your knees, don't just run out and get surgery right away. You want to make sure that it's not something that, you know, well, you just need a couple months break, just icing it and those kind of things. Because a lot of times when you tear your meniscus, there's a lot of people out there that live with it forever and they're okay. You know, it might just flare up a little bit. And we never want to go under the knife if you don't have to. So say we're getting ready to go do our surgery, because that's, you know, your knee is locking in place, and usually this is the reason why they would recommend surgery. If it's more than just a little pain in the knee, but your knee is actually locking and you can't move it and causing quite a lot of pain. Now, there's two types of meniscus surgery. It's either they're just going to go in and clean up the little area that was torn, or it's a more of a severe tear that goes deeper, and they can't really just cut it out, because pretty much, well, I should say most surgeons will want to preserve your meniscus. You know, you want to hang on to that as much as possible. If you just go in there and remove it, well, what's going to happen is that you're going to have early onset arthritis. You're going to have more bone on bone. So they want to preserve the meniscus as best as you can. So there's two types of surgery, right? We just mentioned one, it's an arthroscopic surgery, which really means they go in, they poke a couple holes in your knees, and then one's for a camera and one's for the tool, and then they go in there, you know, the doctor does his thing, looking on the screen, hunts around for the damaged part, and usually, if it's, like I said, if it's just a small bit, and then they clean it up. So yeah, you've done the surgery, and now it's time for recovery. Now, the recovery time depends on what type of surgery that you've done, right? If they went in and just cleaned up a little bit, then it's going to be a pretty short recovery time. You know, you'll be back on your feet in a couple of weeks. But if it's a big tear and they actually have to go in and then put stitches in, they're going to want you to stay off it until those stitches take and the thing heals properly. So then your recovery time is a lot longer. They're going to want you to stay off it, so you're going to be on crutches for probably, I think it's about 8 to 12 weeks. And even then, you know, you still have to be really, really gentle. Now, some people, they're not very smart. Maybe they go off and then they start running around. They feel a little bit good, and, you know, they'll end up tearing those stitches out. And then the next thing is, okay, well, you got to go back to the surgeon. You got to, you know, poke holes again, re-stitch it. So you don't want to do that. There's a couple of things. Right after your surgery, you're going to get medication, an anti-inflammatory medication, and then you're going to also get pain meds, right? Now, a lot of people say, well, yeah, it's not hurting, so I'm not going to go ahead and take those medications. I'll just heal naturally on my own. Now, if you really want this thing to heal up quickly, stick with the doctor's advice and take the medication, right? It's there for a reason. Now, if you have swelling in the knee and you take the medication, it reduces the swelling. It's going to promote blood flow. And especially if you have a deep tear, normally what will happen is that it will heal. There's not much blood flow around the meniscus, only on the outside. And then if you look here, you'll still see me with scars and stuff. This one you won't see anymore. But if the meniscus tear is just slightly on the outside, there's a good chance that it'll heal up quickly. But if it's a deep tear going deep into the knee, there's not a lot of blood flow there. So it takes much, much longer. Now, okay, so we've gone through, you know, what the tear is, what your meniscus is, what the tear is, how do you get it diagnosed, and what the surgery is going to be like, taking your medication and all of that. So you've done all of these things, and now it's time to do therapy. Now, I will tell you, I have a very, very high pain tolerance, but this thing hurt like the dickens, at least for me, for the first couple of weeks anyways. And what will happen is that you will feel mostly pain when you're putting pressure on it, extending and compressing the knee. Now, in my case, like right now, I am 4.5 weeks out from surgery, and then this is about as far as I can bend it. And then they have something called effusion, and that's when you have fluid inside the knee, and then that's my case at this point. So I still have quite a bit of fluid in my knee, and it's going down slowly. Every day I realize I can, I can bend it a little further. But what it feels like is if I was to just like jam my knee back, if I was to grab this and just pull it all the way back, I feel like this is just gonna go and blow up on me. So I don't want to do that. Now, the fluid in the knee bit, that is also something. If it's not going away on its own, you got to go revisit the surgeon again. And what they do is they drain your knee. Now, it kind of sucks. I have never done that. I'm trying to avoid that for this instance. But they end up taking quite a large needle, sticking it in your knee, and then there's tons of yucky videos on YouTube if you would like to go check those out. But that's really what ends up happening. Now we're gonna go through physical therapy, right? Because you've not been using this quad, and I'm even having a hard time filling out this spandex shorts right now because I've lost a lot of muscle mass on my right quad. I don't have big legs to begin with, so I kind of look like a bird walking around right now. So you'll end up doing very, very simple things, and for physical therapy, which in your normal routine you're like, oh my god, this is really easy. But when you have when you've had surgery on your knee and there's pain and inflammation and all of that, everything basically hurts, right? You want to do very, very light to no weight at all, and then yeah, follow the doctor's orders. You know, you're going to want to ice at least 3 times a day, 20 minutes each time. The best way to do it, you know, you drop a bunch of ice cubes in a Ziploc bag, add some water in there so it kind of flows around, gets really cool, and then put a wet towel across your knee, and then just rest it on top. It's just the towel is really there just to keep the direct ice off your knee because it's pretty uncomfortable, right? And don't do more than 20 minutes. 20 minutes is like kind of like the magic number that you don't really want to go too much more. And you can do it as frequently as you want. You know, maybe like every hour even helps if you're that disciplined. But stick with your meds, and then also stick with the icing. And I have to say that I'm very diligent with that. I could be way better with it, but I'm trying. So if you would like to see some of the physical therapy exercises that I've been doing, and then kind of bringing my leg back to 100%, I would say I'm about halfway there right now. Let me know. You can either write us or just drop us a line either on Facebook, Instagram, or over our website. And then we'll go ahead and put together a therapy workout just for folks who've came out of knee surgery, especially for like meniscus tears and that kind of thing. But I hope this has enlightened everybody who has that knee pain that wants to or needs to go do surgery, because sometimes, you know, it's a little bit, the unknown is sometimes a little bit scary. It's not that big. You're not going to be in the hospital very long, by the way. It's just like an in and out procedure in one day. So it's just a recovery. It takes time, and we all have to remember, well, you know, we got to take care of that knee. You want to be on it for quite a while, for the long run. We don't want any knee replacements or anything like that. So anyways, guys, I appreciate it. Hopefully this video has helped you guys. And yeah, we'll talk to you soon. Let me know if you want to see those PT exercises. Take care. Bye.